Hi, good morning, everyone. I'm Dawn Jeffries with Virginia Tech, and I will be moderating this conversation this morning. Several Virginia Tech public health experts are joining me today to talk about the return to campus for spring semester. As you know, spring semester resumed just a few days ago on Tuesday. I will introduce our panelists now with us. Frank Shushak, Jr., Vice President for Student Affairs, Brian Gary, Vice President for Human Resources, Mike Mohair, Assistant Vice President for Emergency Management, Lindsay Marr, Charles P. Lunsford Professor of Civil and Environmental Engineering. She's also an expert in the airborne transmission of infectious disease. Also joining us, Molly Odell, Adjunct Professor in the Department of Population Health Sciences. Dr. Odell has also served as the lead of the pandemic response for the Roanoke City and Allegheny Health Districts. Good morning to you all, and thank you again for joining us. We wanted to talk about the pandemic today. The 2022 semester. And Dr. Odell, if I can start with you first, can you just give us an idea of what you're seeing in terms of in our community in terms of COVID transmission, as well as the impact of that on our area?
So, as you know, throughout the pandemic, Southwest Virginia has lagged behind the rest of the state. So we're fully into our surge with the Omicron variant for sure. We have plenty of transmission compared, for instance, to Northern Virginia last week. Northern Virginia numbers have started to come down just a little bit, and ours are still ascending. We have some hospital capacity, but our hospitals are quite full. So there's plenty of disease, and we are in the surge of the Omicron variant.
Can you talk about that specifically and what you're seeing in terms of Omicron? And do you expect to follow the trend that you're seeing that you just described elsewhere?
Well, what has been described in most places is not as many hospitalizations as would be expected, because on average, the Omicron variant seems to be causing less severe illness. There's more illness, and therefore, in places where there are not highly immunized communities, we're going to have more hospitalizations. And in Southwest Virginia and Southside Virginia, we have some of the lowest vaccination rates in the state. And unfortunately, that is coupled with what we're seeing here, more hospitalizations with the unvaccinated.
Dr. Shushak, I wanted to come to you to ask in light of what Dr. Odell has described in terms of the variant and what she's seeing in terms of transmission in our area. Can you talk about the changes to the vaccine and booster mandates on campus, who that impacts? Or Mike, if you can answer this, it might be best directed at you in terms of who needs to be in compliance with that. I know there were some changes announced this week.
Yeah, Mike, go ahead.
Sure, thank you. So the biggest change from the governor's office was really directed at state employees. So employees, and certainly Brian can add to this, are no longer required to be vaccinated or to be tested unless they want to test voluntarily. Frank maybe wants to talk a little bit about how this impacts students, because it's a bit different.
Sure, and I'm also wondering, Dr. Shushak, if you can talk about the impact on students, as well as would this impact and what comes, would it have any possible impact on the university's efforts to maintain an in-person semester?
Thanks, Don. And first, good morning to everyone. And I just feel like I have to say thanks 1,000 times for all the ways people continue to be flexible and to work with an always changing environment. I know it's tough on everybody. We've been pretty clear that we are committed to an in-person experience this semester, just like we did last semester. And if you remember back to last semester, we had challenges too, but one of the consistent themes has been that we remain flexible and adaptable, and we try to respond to the conditions that are in front of us. And one of the things that Dr. Odell has emphasized, which I think is really important for us to emphasize, is one of the reasons we had a great last semester and why I'm optimistic about continuing our in-person experience this semester is we are a very, very vaccinated community. Our students are vaccinated, our faculty and staff are vaccinated. That has made a huge difference for our ability to operate. And I expect that is going to be very much the case this semester as well. And that's why we do have a booster requirement for our students that remains in place. If you're eligible to have the booster at this time, you're required to have that submitted and uploaded by February 1st. And if you're not yet eligible, you're required to have it uploaded within 14 days of that, of being eligible. And again, that is because we're so committed to this in-person experience. And we'll talk a little bit later about the impact on overall mental health and well-being. But being back in person we've got double pandemics now. One of them is mental health and well-being, and people have really been struggling. And so we've got to hold those things together and understand how in totality we care for ourselves as a community. So that's where we are. Thank you.
Thank you, Dr. Shushak. Dr. Odell, I wanted to ask you, we've talked about the mandate, the requirement for vaccines and boosters being lifted for faculty members. A lot of schools are considering removing mask mandates. Not the university, public schools in our areas are juggling that and making those decisions. Can you talk about some of those changes and how that might impact the direction in which this goes?
Sure. So first of all, to reiterate what Frank said, because we have a very high vaccinated community, we're in the best possible position to start the semester with Omicron right in our faces. We know that folks who get the disease now, even in the face of vaccine, also suffer with at least one other condition like lung disease, diabetes, obesity, some chronic condition. And so it's important that we look out for that part of our community too. If you look around our population, we have lots of people who have other underlying conditions, as well as a very healthy young student population as well. So the masking continues to help reduce the spread, and I'll submit to Lindsay because she knows a lot better than I do about how that works. But the masking is an important layer in our mitigation strategy. It's not just one thing that we're doing that prevents the spread. It's a series of things, with vaccination being a very important part of the mitigation response.
Dr. Marr, I do want to ask you about that, but first I just wanted to make sure there are no changes to the mask requirement on campus. Is that correct?
That's correct.
And Dr. Marr, you are the expert on aerosols, and you've recommended masks in some settings, including indoors. How important is it now to keep doing that, as Dr. Odell has just said? But also, I know you've spoken about sort of upping our masking game and the quality of the masks that we need to be wearing now. Can you elaborate on that?
Sure, I'd be happy to. Thank you. Well, as Dr. Odell mentioned, masks are an important tool, one of several tools that we are using to control to try to control transmission or to reduce it. We are in the midst of a huge Omicron surge, as everybody knows, and so the chance that you're going to be in a room with someone who's infected is higher now than it's ever been. And we know that people who are vaccinated, they're strongly protected against severe disease and hospitalization, but they can still spread disease. And so in order to help us tamp down this surge and get past it as quickly as possible, we we need to have everyone wearing masks indoors. And while masks are not created equal, any mask is better than no mask. But there are masks that are very protective. Those are called respirators, such as N95s or KN95s, the Chinese version, or KF94s, which are the Korean version. And so, during this time with Omicron being so prevalent and so easily transmitted, if you want to, provide the best protection for yourself and others, you can do that by wearing an N95 or, as I mentioned, KN95 or those other equivalent types of respirators. They provide over 90%, ideally 95% or better protection compared to a typical cloth mask by itself, which might provide 20% protection. A surgical mask by itself might be 50%. If you have one of the better cloth masks with the filter built in, you can get 60 to 80% protection.
Mike, can you talk a little bit about the masks and the need for finding better quality masks or wearing better quality masks? Is that something that the university will help provide for employees?
Sure, be glad to. In Dr. Sand's comments last week talked about getting a better fitting mask, and he certainly mentioned the KN95 type mask. And the university has already distributed 60,000 of those masks. There's another 100,000 on order that'll be in next week. And what we're looking to do is something similar to what we did a year and a half, 2 years ago, when we made masks, at that time cloth masks or surgical masks, available to the entire community. So we will be replicating that distribution system, and essentially if somebody needs a KN95 mask on campus, they will be able to get one. Working with Frank and Student Affairs to make sure they're available in the residence halls and at locations where students frequent. Also making sure they're available in the offices for our employees as well. We will be distributing K95s, not N95s, because as an employer, if we started distributing N95s, there's some OSHA requirements with those, because there's a slight difference between the two masks. But the KN95s are very effective, and again, that'll be it's the type of mask that we will be distributing across the campus.
I think we touched on this a bit earlier, but I'm wondering if we can focus on employee vaccinations and testing requirements. Can you talk about testing? I know you mentioned the no longer a mandate for vaccinations, but what about testing?
So yes, as part of the governor's executive order, there's no longer a mandate. Certainly Brian can talk about the details better than I can, but there's no longer a mandate or a requirement for testing for those that are unvaccinated. Having said that, through the VT Notify system that's managed through Schiffer, there is testing available on campus on a voluntary basis, and we're looking also to augment that testing, provide other testing opportunities. So again, we urge those that have been part of our testing program to continue to be tested. We urge those that have some concerns about their health to take advantage of the testing that's available on campus. It's very convenient. I did it yesterday. It's a very simple procedure. Results are usually back within 48 hours. So there are testing resources and opportunities available across the campus. Brian, I don't know if you had anything to add to that.
Only to reiterate that the requirement is no longer in place, but our commitment's the same. We believe in vaccination and boosters. We want to collect that information so that we can tell the community how highly vaccinated we are, and we can kind of track vaccination status to not only reassure, but to help us prepare. So we'll continue to collect information on vaccination and boosters. It just won't be required as a condition of employment. Same for testing. We have had a requirement in place for testing of some groups that'll no longer be a requirement. That doesn't believe that we don't advocate for testing where necessary. So really our position is the same. We've just removed the requirement. And I'd just like to also reiterate Frank's appreciation, and I know all of our appreciation for the community. Faculty, staff, and students have really been remarkable through this experience. And as Frank noted, I'd like to at some point mention some of the resources we have, because while we are very much focused on this variant and how we can protect ourselves, I do want to encourage us all to take a look at our whole person and how we can maintain our own mental health, our physical health through this very long process. We will get through this. This is long, it's painful, none of us like it, but we are resilient and we will get through it. And so I think while we need to kind of protect ourselves in the short term, and certainly vaccination and boosting and masking is the way to do that, please also step back. And as we're in the winter time, I want to encourage all of our viewers and listeners to take care of their whole health and the people around them, because we still have a way to go through this, but we will emerge and we'll be stronger at the end of it.
Thank you, Brian. I want to come back and talk a lot more about mental health, because I know there's a lot of anxiety out there among all of us, really, and employees, students, everyone in our community. But I want to ask a couple of more questions regarding testing and masking. First, you were clear about the changes to testing for employees, but does that hold true for students? I know some students, especially unvaccinated, I know that some have exemptions for either religious or medical reasons. Will they still be required to have testing?
The requirements for students are exactly the same as they were last semester. So if you have an exemption, you would participate in the testing program just like you did last semester.
Great, thank you. Lindsay, I wanted to go back to you, and I know that you were doing so much testing on masks, and one of the basic questions, especially when we shift to using KN95s, my cloth masks, we throw them in the wash after one use, but now with KN95s, there's a lot of questions. People are wondering, how long can they wear them? You can't wash them. Can you tell us what the do's and don'ts are and how we should manage this new accessory that we have?
Yes, definitely. You want to, the KN95 is made of a different type of material that is very good at filtering out small particles. And so you need to treat it differently from the cloth mask. You should not wash it. It has an electrostatic charge on it that helps it capture particles. And if you were to wash it, that would remove that charge. But the material itself is very tough and durable, and it will last for a long time. And so the biggest concern is whether it gets dirty or ripped, or maybe the ear loops will become stretched out and too loose, or they'll break before there's any loss in ability of the mask to work. So as with cloth masks, you want to kind of try to handle it around the edges and avoid rubbing your fingers right on the front of it, so that in case there is virus there, you don't contaminate your fingers. Otherwise, aside from the washing, the washing is different. They will last a long time. So I've worn one on, a related type of mask on several different airplane trips, so totaling probably over 40 hours. And you can think of that as the time you're actually wearing it. So if you're going to class for 2 or 3 hours per day and you're wearing it in that class, well, okay, there's 2 or 3 hours, and then you can probably keep using it until it gets kind of icky, or the straps get too loose, but they'll last a long time.
Is that consecutive wear, or should you take a break each day and maybe have, a new mask for each day of the week and alternate? Or
I think for healthcare professionals, it's been recommended that they rotate their masks. I mean, that's something you can do. I don't think that is absolutely necessary. If you want to do that, so certainly that can, that can help give your mask a little more time in case there is virus for it to decay on there. Although really it's going to decay within a few hours, and it's really hard for it to come back off of the mask unless you really try like rub your fingers on it.
I appreciate that. Thank you. Brian, are there any resources for employees who have COVID, for employee family members that may have COVID, when it comes to leave, when it comes to just managing the unknown?
Certainly. The state's public health emergency leave has been reinstated in 2022. So all faculty and staff do have the benefit of 40 additional hours of leave if they are ill or taking care of a member that has come down with COVID or need to quarantine for isolation for COVID purposes. So that is available. That is a leave that has that did expire and then has been reinstated. So that's a bit of an extra buffer for our faculty and staff, and also includes our non-student wage employees. I also would like to mention all of the wellness resources. There are so many out there. It's often forgotten in the day-to-day. We have counseling sessions through our employee assistance program that are available that provide not only mental health counseling, but also counseling on financial issues that people may be experiencing or legal issues that people may be experiencing during this difficult time. We also have clinics that provide boosters and vaccinations, and there's another one coming up on January 25th. We also have a mental health first aid a class, a session that really can help people in a very safe way, kind of, maybe get some resources to help them through a difficult time. And there's all other resources at Hokie Wellness. We have an amazing wellness team and many programs to help faculty, staff, and their families. So encourage folks to please go to the Hokie Wellness website and learn more.
That's great information, Brian. I'm wondering if you could speak a little bit to sort of the worry that a lot of folks have, a lot of employees have. I understand the leave and things that are available if someone has COVID, but what about employees who are dealing with other types of challenges that are pandemic related, like childcare, like mental health issues that may need to take them out of work? But is that something that the university administration, that you all are discussing and supporting?
Well, many of those resources have always been in place, but certainly the need has been elevated during this pandemic. And there has been an ongoing commitment to providing as much flexibility as possible, recognizing that degree of flexibility will vary depending on the kind of work someone does. But there is very much an appreciation and a commitment for all that our faculty and staff are going through. And so, yes, Dawn, there's any number of other options through family medical leave, other leave, flexible work options, et cetera, that can provide some space for people to be able to take care of their own personal and family needs while certainly fulfilling the university's obligations and their employment responsibilities. We're working hard every day of trying to kind of create more of that space for people to navigate what is a very difficult time with kids going back to school, limits to childcare availability because of the talent and workforce shortages in the area, as well as the threat of Omicron. It's a complex environment. We all know this. Everybody's life is different and complex and challenging. So we certainly try to meet people where they are and work very closely with them. So for all of the faculty and staff out there, please work not only with your department, but your HR colleagues that are embedded in most of the major units. Call our human resources office, our wellness team. There are any number of places, our ombuds office. There are resources for people to get some help and talk through these things and explore what options can work for them at a difficult time.
It's a great reminder. Thank you. Frank, Dr. Shushak, you have consistently talked every time we've had one of these conversations about the importance of Hokie Wellness and mental health resources. Can you just reiterate that and the resources for students available now? Because I think that the things have changed a bit. There's still so much anxiety, but the focus is a little bit different.
Sure, Dawn. And I always like to remind people, as a culture, especially young people, but as a culture writ large, we were struggling before the pandemic. We were struggling with mental health and well-being, and we were working on trying to bolster the mental health and well-being of our community before the pandemic. But if you've been alive the last 2 years, it has been rough on people. And that's on top of struggling before the pandemic. the constant pivoting, the clear uncertainty every single day of knowing kind of what the world is going to be like. And then we've just had all sorts of larger cultural challenges on top of that. All that to say, it's been really hard for everybody. And it's really important that people recognize that they're not the only ones by a long stretch, that it's hard out there. Now, coming in the spring semester, January and February is always the toughest month for me. It's dark, it's cold, really cold, and we got a ton of snow. And then, gosh, my Dallas Cowboys lost in the playoffs. And I mean, it's been rough. But there are some really important things to do. And some of them are simple, but they take some discipline. Finding your way towards exercise, getting some good sleep, paying attention to what you're eating. We really want our students to think about these things, because you may be in a mental health ditch right now. And if you're in a mental health ditch, we want to help you get out of that. And we have a lot of resources for that. But maybe you're not yet, but the important thing is to keep yourself from getting into that ditch too. So, that's really, really important. And I encourage everyone we have a campaign. It's VT Better Together. And all the mental health resources are there. A lot of really important information. Brian has already talked about Hokie Wellness. I think coming out of this pandemic, we've got to really roll up our sleeves and individually and collectively pay attention how we build our emotional and physical and mental well-being back up. And that's going to require us all to be really caring and compassionate with each other. And I'll emphasize this too, is we're all, people are tired and annoyed, and but it sure can make a difference if we can reach out and see other people with a sense of kindness and empathy and understand the complexity of everything everybody's feeling. And Hokies are pretty good at this already. So let's lead the way.
Thank you. Mike, I think this question is for you. I'm wondering, a lot of people have flocked to, or were flocking to, the dashboard that the university had up looking at numbers. I'm wondering where that stands. Are there new metrics, and why? What's the focus?
Sure. So great question. So we're in the process of updating the dashboard, and we should be rolling out a new version of that very shortly. I think the biggest change everyone will see is looking at additional metrics, and one of the critical metrics to look at as we manage COVID, as we manage this new variant, is what's the severity of illness, and Molly talked about that a little bit. So we will be through our case management system, we will be collecting that information, and we will be presenting that information, and and how many people who are positive are asymptomatic, how many having mild symptoms, how many having moderate symptoms, and then those that may be having severe symptoms. And we looked at this type of data presentation and collecting this type of data in other areas, and what it shows, and shows very clearly, and I think and this was really even before Omicron, was that most cases, the preponderance of cases, are either asymptomatic or have mild symptoms. So again, we want to start looking at that virulence data, as well as just where previously we'd focused just on transmission and how many positive tests we had, and how many positive tests we had in the most recent time frame. And just kind of talking about that a bit, my background's engineering, so I like numbers and I like data. And one of the things we looked at last semester was transmission rates, and the transmission rates among the Virginia Tech community and those of the surrounding communities and the surrounding regions. We also looked at positivity percentages, and our numbers all through the fall were much, much lower than the surrounding communities and surrounding region. But what we're seeing now, as we move into this semester, that trend is continuing. Where positivity numbers are, in the 30 to 40% in the region and across some areas of the state. Ours, while elevated from what they were last semester, still remain very low. And really, truly, that's a function of what we really started this conversation off with. talking about the benefits of vaccines and boosters. Having a 95+% vaccine rate would be great if we could even nudge those numbers up a little bit, because it makes a difference. Certainly the impact of the virus within our community, within our bubble for Virginia Tech, is much different than it is within the surrounding area. Vaccination boosters work. There's no question about it. The data supports that.
I'm wondering how things are. I know it's early. The semester officially started Tuesday, but students were moving in before then. I'm just wondering what it's looking like as we start off with students in dorms in the residence halls. How's it going? And also, how is the university now managing this semester students who might get sick?
Thanks, Dawn. You might recall that we required every residential student, a student who lives on campus, to have a negative COVID test before within 72 hours of moving in. And thanks to our students for doing that and doing that really well. I think our students, as is typical, have done really well and continue to work hard to protect others and to take care of themselves. And so we have a lot to be proud of there. Now, we are begin talking about the shift that is really in process that will continue for a while, which is we know that this pandemic is going to shift in the direction of endemic, and that process is already happening. And post the Omicron surge, we're going to be in a world where COVID is going to be with us for the foreseeable future. And some things are different there in that we have vaccines. If you think back a year and a half ago, we didn't have vaccines. We didn't know a lot about these viruses, and we definitely didn't have all sorts of therapeutics that we have now. We're in a very different position than we were a year and a half ago. And so we're moving to a place now when a student tests positive or gets COVID, that the number one option is that we encourage students to, if it's possible, to go home for a short amount of time, usually 5-6 days before they test negative, and then come back to campus. And when that happens, we ask them to reach out to the Dean of Students office, who can provide them an absence verification. You can also check up on them. But if a student is unable to go home, it may mean that they need to stay in their room. And so by the time someone tests positive, more than likely they've already exposed their roommate, and that's just the reality of it. And so the best analogy I can offer is we're going to have to begin thinking of this more like we would think about someone who gets the flu. If you have a roommate who gets the flu, that you're not typically going to have to be moved to isolation. You've probably exposed your roommate to the flu. So, but there are things that you can do to mitigate in the event that you hadn't. You can wear your mask and take care of yourself. But that's where we are this semester, and we were last semester too. We don't run a quarantine and isolation facility like we did last year. So that's a shift, and our students are doing really, really well with that, and we expect that to continue to be the same.
Brian, I have a sort of a two-part question for you. I'm curious if what we're seeing nationally is reflected here in terms of workforce shortages. Is Virginia Tech experiencing that? And secondly, if so, and if not, if that were to happen, how is the university prepared to manage that, whether that's, someone in your office or someone in the dining halls?
Well, yes, we're certainly experiencing the same challenges that the rest of the country's facing in terms of just a low supply of available workers for many of our jobs. And there's, this is evolving. I think 2022 will continue to be a challenging time for employers to be able to identify the right people for the right work. So we're not alone in that. challenge. And so, yeah, we've done a number of things to try to not only retain the valuable faculty and staff that we have. I think that's one of our primary focus areas. And we've done a number of things in that space to boost pay, to really address climate issues, to try to continue to support the wonderful people that support the university now, but then also kind of use creative approaches in how we source new talent to join our university. It is a challenge. It's not an easy challenge to overcome because we are at pre-pandemic levels in terms of the unemployment rate is at 3.9%. It's actually lower in the New River Valley. The available workers are at, again, a pre-pandemic low. So it's really an interesting juxtaposition with what we're facing in terms of the crisis, which is, of course, very real and very scary. And at the same time, there's a real shortage of talent. So the combination of that with the risk of losing people for illness means that there is some risk to university operations, and we're doing our best to mitigate that. Obviously, this is where flexible work can be helpful because we don't necessarily have too many people congregating all together unless the job requires that to be able to deliver the service to students and to the university. This helps us mitigate folks that not only get ill, which is first and foremost, but also any operational impacts from people being away for several days, maybe recovering from the flu or from COVID or from something related. But it's a very real problem, Dawn, and it's we're trying any number of ways to address it.
A couple of policy related questions, Mike, that I'll bring to you. One, if a student tests positive for COVID, is there a need to have a test after any sort of isolation is done? And secondly, I'm just curious about events and places where people gather, what the policies are, for example, at athletics events now that we're indoors, at places like the Moss Theater.
Sure. So, Dawn, with your first question, currently we're not requiring that, and part of that is there's actually a bit of a testing shortage across the regions. So we're trying to maximize the utilization of those tests. Our tests most are done through the Fralin Center, and they also do testing for the entire region. So there's a huge demand on those services. Ideally, we would do that, and we may get to that point as we learn more about the changes in the CDC isolation policies. But currently, right now, that's not an absolute requirement. For your second question about events, is one of the things we've done recently is the requirement of essentially proof of vaccination to attend some of our larger gatherings where we bring in a lot of the outside public to essentially the bubble that is Virginia Tech. So that includes our events, sporting events, particularly those in Castle Coliseum, the Mossad Center, and there may be a few other smaller venues where there's a larger or greater population from outside Virginia Tech that participates in those. Again, it's one of the tools we have to essentially kind of minimize those transmissions, and again try to kind of tamp down the surge. And again, it gets back to what I said earlier, that vaccinations make a difference. Vaccinations make a difference, and having a population that's highly vaccinated makes a difference in the severity of what we see across the community. So those are some of the steps we've taken. Again, we hope these steps are all short term. We hope as we come back, as we come out of the Omicron surge, we will reevaluate our mitigation strategies and adjust them accordingly. That even includes at some point looking at masking requirements. We were on a trajectory late last semester where we thought mask requirements could be reduced, and then certainly then we had this surge that put us in a position where we can't do that yet. But again, all the things we look at and with managing COVID is how do we get back to normalcy, and how can we do that, recognizing that we also may have to change our mitigation strategies based on what we're seeing happening with the virus. So again, it's a constant reevaluation of what we're doing, what mitigation steps we're taking, and how we may have to add or subtract from the ones we actually have in place. So that's where we are with events for the short term anyways.
Dr. Marr and Dr. Odell, I'm wondering if you can talk about that sort of sense of normalcy that we want to get back to and what that looks like right now. Can we start having more or increase the sort of normal activities we do as long as we're masking? What are you seeing? I know, Dr. Marr, you mentioned planes and wearing a better mask on a plane and being able to travel. What are your thoughts on just resuming everyday activities or things that we used to do without thought?
That's a great question because we've been living like this for 2 years, and everyone wants to get back to the normal activities. Between the vaccines with a booster and a high quality mask, such as a KN95, I feel pretty confident about doing my normal activities. The one thing I'd watch out for is eating indoors with people outside my cohort. I'm not quite ready to do that yet because we're in the midst of this big surge, but I hope that as the numbers go down, I can get back to that. So we have the tools available to us to be able to get back to normal. And I think, I'm hopeful that once the Omicron surge is past, we will be able to move even inch closer back to that. But the virus has been very unpredictable. We've talked about this multiple times, how we've thought things would be over. So I don't want, I say that with a grain of salt.
I appreciate that. Thank you. Dr. Odell, that you want to add to that?
Yeah, I like what Lindsay said. And I would say that I think most people in the world have learned a few things about making decisions for themselves. Before the pandemic, I saw so many people still toughing out, going to work and school sick. That has changed dramatically. And I think that's been a good thing. So as we move towards this endemic stage, what I hope is that people will look at their own personal health circumstances and weigh the risks versus the benefits of whatever activities. Obviously, this is a vaccine preventable illness, and we have that tool. And we know that when we're in large spaces indoors with people who we don't know the status of their vaccine or their health, it's good to wear a mask. And those simple strategies can help us get through these next bumps that may come along.
That actually sounds like a great place to start a wrap up, but I wanted to ask you, and I'll ask everyone, any final thoughts or recommendations or words of advice? Dr. Odell, you want to take
that? I think one of the biggest things we hear, particularly at Virginia Tech, has been about what about the safety of the vaccine? And I think it's important for us to remember that there is no medical intervention from taking a Tylenol to open heart surgery that is without risk. And we know that these vaccines work, and there are documented side effects that we have quantified. And as of 10 days ago, and 520 million doses given in the United States, the major side effects from these vaccines are rare. And so it does call upon us to stay aware of what the recommendations are and what's best for us. But this is definitely a vaccine preventable illness.
Thank you. Dr. Marr, any final thoughts?
I just want to commend the Virginia Tech community, students, faculty, staff, everyone really for following public health guidelines and doing everything we can to reduce transmission and make Virginia Tech a safer place to be so that we could have this in-person experience that we so value. I just want to remind people that there's no one silver bullet that's going to prevent transmission. We really need a combination of multiple tools. We know what those are now. It's vaccines, it's masks, it's good ventilation, it's avoiding indoor crowds if you are at risk or if you have symptoms yourself. We have those moving forward, and I think it's prepared us well to tackle whatever comes our way.
How about you, Mike?
Sure, just kind of one more comment on masking. There's a lot of information about masks. There's a a lot of different types of masks out there, and people talk about N95s and KN95s, and there's really a difference between those two masks. And N95s are very, they can be, some people can have some challenges with an N95, breathing with an N95. But a KN95 is an excellent solution. They're much easier to breathe with. But even some individuals may have challenges wearing a KN95. And I just want to pick up on something Lindsay said earlier. If that's the case, then you know, wearing a surgical mask with a cloth mask over it might be a much more comfortable fit. Provides a fairly high level of protection and serviceability. So again, while we're providing K95s for the campus, and we think that's a good place to be as far as a tight fitting mask, a better fitting mask, we do recognize that not everybody can wear one of those, and we certainly work with others on work with individuals on an alternative to the mask. The need to wear masks with masks is key. It's an important mitigation tool, and we need to continue doing that for a little longer.
Thank you. Dr. Gary?
Well, I'll just say that we all know that the changing guidance can be confusing and frustrating at times, and it changes just because the conditions change. I think we just have to accept that today is not what tomorrow is going to be, and it's just going to continue to change, and recognize that it is confusing. It's difficult to understand what to do and when to do it. And so I would just encourage everyone to really take care of themselves first and foremost. And we've given some ideas today in terms of not coming to work when you're sick, and certainly getting the vaccine and booster if you haven't done so, and wearing a mask. But in addition to all of that, please just take care of yourself and leverage the resources that we have available and the people in your life that can reinforce your health and well-being, and take the long view in addition to trying to be as flexible as possible in terms of the guidance, because it will change again. And last thing I'll say is, folks really do care about you. And even though it can be frustrating when things change, it changes just because many of us who are in a position of kind of digesting all of this new guidance are trying our best to distill it in a way that's very actionable and practical. And it will vary depending on the day and the month. And it's all intended to try to help our community get through this together.
Thank you. Dr. Shushak, I'll let you close, please.
Thanks, Dawn, and thanks to my great colleagues here for a good conversation. I wanted to close by saying thank you to lots of people. One of the opportunities that I have at Virginia Tech is to talk to people who sometimes disagree with some of our policy decisions and choices that we're making. One of the things that I can say about that is that almost always those comments and feedback are generated with kindness and care for the community. And I really, really appreciate that. And I just want to reiterate that I think Virginia Tech works really, really hard to make the very best decisions for the community that we possibly can. And lastly, let's make today a day where we stop and see someone and tell them that we appreciate them and that we see them, and call out something good and see if we can move a little bit forward today.
Thank you so much to all of our panelists, Mike Mohair, Frank Shushak, Dr. Molly Odell, Brian Gary, Lindsay Marr. Thank you for sharing such great information with us as always. And I appreciate you taking the time. And as things change, just wanting to let our viewers know, you can always find the latest information on what's happening on campus, as well as in our community as it relates to campus on the Virginia Tech website, vt.edu. Thank you. Thank you for staying.